One of the other questions I get is, who's a good candidate for this? And really what I can say or speak to that is it's individualized. It depends on the individual and their specific condition. It's hard to paint broad strokes. You look at the data and the research that's out there, and yes, there's studies that have absolutely been done that are good quality studies showing safety, showing efficacy, and you can pull some numbers depending on what you're treating. If it's knee arthritis, hip arthritis, some autoimmune conditions, things of that nature. And in general, when you screen the patients and you've done your individualized consult and you felt that you could help them, on average, depending on the joint, you'll be anywhere from 70 to 80% of them will get a good response and feel that it was worthwhile. That 20% that tells you they didn't feel like it did much, well, they weren't harmed. They weren't made worse in any way. They just felt like at the end of the day it didn't make them better, which obviously you want to screen and do the best you can to avoid that. You want to get this as close to a bullseye as you can. That's the goal, and that's why ongoing research, figuring out how to make this better and better, what are some subtle nuances that make someone a better candidate than others. That's why the research is so important to continue, to figure out how do we best utilize this to help the most people. So what I would say in general is, if you're wondering if you're a candidate, well, find a clinic. At ours, we don't even charge for the consult because I like to educate, because I feel like there's a lot of misinformation and a lack of information out there. So I like to use actual statistics and data and research to really help people understand this, not just take my word for it. And whether this is something we're going to move forward with or not, I just want all my patients, after my consult, to feel like they have a better grasp on stem cells, the different types, what they can be used for and what they can't be used for. So if you're wondering, I'd encourage you to schedule a consult either with someone in my clinic or any clinic for that matter. Just make sure that they can answer your questions effectively, give you clear, concise, factual, data-driven answers, and they're not afraid to show you around and show you how they do things.